Hafare Guam and beyond. I just finished a clinical immersion week over the summer at the Pacific Pearl, which is a renowned integrative medicine clinic in La Jolla, California. So they have a holistic team that consists of integrative cardiologists, a naturopathic doctor, a chiropractor, acupuncturists, health coaches, pain management specialists, and healing touch providers. So I was there as a fellowship student for my integrative medicine fellowship, and also I managed to get a consult as a patient myself. So over the course of the next few videos, I wanted to share some of the clinical pearls I just acquired while I was there at the Pacific Pearl. So first, I'd like to cover the cause of coronary artery disease and heart attacks. And oftentimes physicians focus heavily on cholesterol, particularly LDL cholesterol as the main culprit. While it is true that LDL supplies the cholesterol to be deposited in the coronary arteries, I really want to shine the light on the actual catalyst that sets off this process of cholesterol deposition and heart attacks. And that catalyst is inflammation. So there can be numerous sources of inflammation. It could be just the sheer force of high blood pressure that can damage the endothelial lining of the cardiac arteries, and that can cause inflammation. There's various toxins. It could be like smoking that cause inflammation. Even high insulin and glucose can damage the blood vessels. So the basic formula for heart disease or heart artery blockage is inflammation plus elevated cholesterol. So this is the reason why people can still have heart attacks despite controlling their LDL cholesterol to optimal ranges, because they are not addressing the inflammation and endothelial dysfunction. So how can you tell if you have endothelial dysfunction? There are a few ways to really assess that. You can draw blood to see if you have elevated hsCRP, myeloperoxidase, and Lp(PLA2, which are markers of vascular inflammation in the blood. You can also use an endopat device in the clinic. And another way is to have a coronary artery calcium score done, which is basically like a CT of the heart. It shows if you have any calcium buildup in the arteries. So I was able to get that done in San Diego for about $99, and thankfully I had a score of 0, which means no calcium buildup. So what do you do if you have elevated markers of vascular inflammation or an abnormal endopat or a coronary calcium score? You have to really work with your provider to find the sources of inflammation, whether it's diabetes, autoimmune disease, intestinal permeability, chronic infection, and you have to start really taking measures to heal the lining of the arteries. So traditionally aspirin has been used, and it's been effective in decreasing inflammation. Also statin medications not only lower LDL cholesterol, but they can also have some anti-inflammatory properties. And you can also take various supplements as well to help repair the endothelial lining. A supplement called Arteriosil has rhamnon sulfate derived from Monostroma nitidum, and it really enhances the barrier function of the endothelial cells. It prevents the deposition of LDL and maintaining the barrier function even in the presence of glycocalyx degrading enzymes. And there's a few mouse studies and in vitro studies that show the effects of this compound. So another product called Vasconoc HP from Designs for Health has various compounds that increase nitric oxide production, which can improve blood pressure as well as repair the endothelial lining. And this has a lot more placebo-controlled studies, and in future videos we'll probably go into more depth of that literature. So if you want to purchase some of these supplements, you can click on the link in the bio and enter the practitioner code Luan Wen, no spacing, when you're setting up your account at Designs for Health.